Hello everyone and welcome to the webinar. My name is Amanda Hooper from the National Women's Law Center and I will be moderating today's webinar. We have just a couple housekeeping notes before we get started. First, all lines will be on mute during the presentation, but we will be doing questions at the end. So there are two ways that you can submit questions. First, you can submit questions during any time throughout the webinar by typing it into your webinar toolbar and submitting send, and then we'll get to those at the end of the webinar. And also, if you would prefer to ask your question over the phone line, there is a raise hand function in your webinar toolbar. And if you try raising your hand, that will flag for me as the moderator that you want to say something over the phone line. And so when we get to the Q&A portion, I can unmute your phone line and I'll say your name and I'll say, please go ahead with your question. This webinar is being recorded and we'll share the recording afterwards along with the slides. And without any further ado, I would like to turn the floor over to Gretchen Borschelt, who is Vice President for Reproductive Rights and Health here at the National Women's Law Center. Gretchen, take it away.
Thanks, Amanda. Hi, everyone. Thank you all for joining us today, and I want to especially thank Upstream for inviting me to talk to you all today about the Affordable Care Act birth control benefit. So I just wanted to start by introducing myself and showing you a picture so you can see who's talking at you for the next 20 minutes or so. So I'm Vice President for Reproductive Rights and Health at the National Women's Law Center, and for those of you who aren't familiar with the Law Center, we have worked for more than 40 years to protect and promote equality and opportunity for women and families. And we really champion policies and laws that help women and girls achieve their full potential at every stage of their lives. So whether that's at school, at work, at home, in retirement. And the birth control benefit of the Affordable Care Act really squarely fits in that. We know how much it's done for women, and I'm going to talk a little bit about that more later. But we have been very involved in the birth control benefit, getting it in place in the first instance and making sure that it's working the way it should. So I'm really excited to join all of you today to talk about that benefit and to talk about what you might hear from patients or others that you're interacting with as you try and make sure women get the birth control that they need and want. So what I thought I would do is start by just reviewing what I'm going to be covering in the webinar today. So as I said, I'm going to be talking very specifically about the birth control benefit that requires plans to provide coverage of birth control without out-of-pocket costs. But before I get into the specifics of what's actually required, I wanted to put this benefit in a slightly bigger picture in the context of the Affordable Care Act and how it's changed things in insurance for women specifically. Then I'm going to review the birth control benefit specifically and what's required, and tell you about our Cover Her hotline, which is a resource that we offer for individuals or for providers who have questions about the benefit or need help making sure they get the birth control they need. And then I'm going to talk you through some of the common problems that we hear, including through some callers in Delaware who have contacted us about problems that they face trying to get birth control and how we've solved it, and give you a sense of what you might encounter and how to resolve some of the common problems. So with that, I'm just going to go ahead and get started and expect to talk probably for about 25 minutes or so, and then hopefully we'll have plenty of time for Q&A and look forward to hearing from all of you about what you've encountered so far and what you might expect and any questions you have. So we'll go ahead and get started. So before the Affordable Care Act, I just want to remind everybody what it was like, what insurance was like before we had this law. Obamacare is the other name for the Affordable Care Act. And we know that prior to having Obamacare or the Affordable Care Act, that the insurance market really failed women. And what you see here is an image of a woman being denied, and that's because we know plans could deny coverage altogether for what they consider to be pre-existing conditions. And for women, that could mean having had a prior pregnancy, having had a prior cesarean delivery, being a survivor of domestic violence or rape. Those are all reasons that plans used to deny coverage to women altogether. So a woman often couldn't get coverage in the first instance. And then if she were able to get coverage, we know that plans routinely charged women more than men for the same coverage. So she would have to pay more to get the coverage. And then we know that plans didn't even cover what women needed, like maternity care or birth control or well woman visits. There are a host of services that a woman might need that plans just didn't cover. And so really it meant that she was left without the coverage that she needed, and she couldn't afford the coverage that was there. Now, when it came to birth control specifically, there was clearly an unmet need. So prior to the healthcare law, we know that the costs of birth control made up 30 to 44% of a woman's total out-of-pocket healthcare costs. That's a lot of money. And the individual costs of different methods made a real difference in terms of what a woman would choose for her birth control. And here you have an image of a slide we put together around debate of the Hobby Lobby case from the Supreme Court. But you can see what we tried to do is show the true cost of birth control for an individual who's making minimum wage, right? So look at an IUD. The upfront cost of an IUD, which sometimes can be around $1,000, means that that would be nearly a month's salary for a minimum wage worker. So you can understand how someone in that position isn't going to choose that more effective, more long-acting form of contraception. And we know that costs of birth control led women to use it incorrectly, to use it inconsistently, or in some cases to just go without altogether. And that, of course, contributed to the high unintended pregnancy rate in this nation. And you all know that better than anyone else, given Delaware's extremely high rate of unintended pregnancy. What a problem that is. The risks to the health of women and children, what it means for women being able to move forward in their career or to finish their education. So all of those things were part of the picture for women before we had the Affordable Care Act. And we love the Affordable Care Act because it changed all of those bad things in insurance. So we know that thanks to Obamacare, thanks to the Affordable Care Act, plans can't charge women more than men. We know that plans can't deny coverage because of pre-existing conditions. We know that plans have to cover the services women need, like maternity care. And we know that plans have to cover a certain list of preventive services without cost sharing. And it's this preventive services requirement that we're going to dive into a little bit more. So the preventive services requirement. So here you see what plans have to cover. They have to cover certain preventive services without any cost sharing. And you see here the list of the 4 categories of preventive services that plans have to cover. The first are USPSTF A or B rating items or services. The second is immunizations that are recommended by the CDC. The third is a set of preventive care and screenings for infants, kids, and adolescents as determined by HRSA, which is the Health Resources and Services Administration. And then it's this 4th bucket, preventive services for women as determined by HRSA, where the birth control benefit comes from. So that's the key category that gave us this birth control benefit. So digging into that a little bit more. Here you see the list of the women's preventive services that have to be covered by plans without cost sharing. And you can see that birth control here, which is in bold, is listed alongside a number of other types of women's preventive services, like well woman visits, like breastfeeding services and supplies, like screening for interpersonal domestic violence. This list was determined by 2 independent expert panels and is now required to be covered by all new plans without any cost sharing. So let's talk about what that means when I say it has to be covered by new plans without cost sharing. So first of all, let's look at which plans have to comply. When I talk about new plans, the reason I'm using that phrase is that there is a provision that allows certain plans that have been around long enough to be grandfathered in, and they do not have to comply with it. So if your plan existed before the date the law was signed, so before March 2010, and it continues to exist the exact same way, it hasn't made significant changes, then that's a grandfathered plan, and it doesn't have to comply with this preventive services requirement. But there aren't that many grandfathered plans left in the world, so we know that in 2011, a year after the law was signed, that there were 72% of plans were grandfathered. And now, in 2015, the latest data we have, 35% of plans still have grandfathered status. So that number is going down, and we expect that eventually it will be 0, and that all plans are going to have to cover this preventive services bucket of services. But there are still some grandfathered plans, and that's going to come up a little bit more as we talk about common problems that we hear. But new plans that aren't grandfathered, sponsored by employers, have to provide this coverage. Plans that are purchased in the individual market, these are the plans that people purchase either on their own in the new marketplace that was set up by the Affordable Care Act or outside the marketplace. And these are plans that sometimes individuals purchase through an insurance agent or a broker, or they can purchase directly from the insurer. So those all have to cover the preventive services without cost sharing. And then finally, individuals in the Medicaid expansion population. And Delaware is one of the states that expanded Medicaid, and so the individuals in that Medicaid expansion get this coverage of all the methods without cost sharing. Okay, so that's which plans have to comply. Now let's talk about what no cost sharing means. No cost sharing means no co-payments, no deductibles, no co-insurance. So if an individual that comes to you to get one of the preventive services is in a plan that has to be covering it, they can't pay anything when they get there. They shouldn't have any co-payment, any co-insurance. There should be no deductible. They should be able to get the service they need, and it should be fully covered by insurance. Let's talk about who is covered. So coverage for the preventive services is for all enrollees, and that includes dependent children. If the plan offers coverage to those dependents, they get that same coverage of the preventive services without cost sharing. And of course, a great part of the Affordable Care Act is that it lets dependents stay on their parents' plan until age 26. So we know that there's even more coverage for dependent children, and hopefully that means more of them are getting this preventive service coverage. Okay, so now let's dig in a little bit more to the birth control benefits specifically. So the requirement is that all plans, new plans, cover all FDA-approved methods. So what does all FDA-approved really mean? I put a link here that will take you to the FDA birth control guide. That's where they get the definition of what an FDA-approved method is. But I also have it on the next slide. So here you see the list. There are 18 method categories of birth control for women that have to be covered by the Affordable Care Act. And you can see here they're grouped, right? So you see there's sterilization surgery for women. There's sterilization surgical implant for women, the rod, 2 categories of IUD, copper and hormonal, shot and injection, patch, the ring. You see 3 different categories of oral contraceptives, diaphragm with spermicide, sponge with spermicide, cervical cap with spermicide, female condom, spermicide alone, and then there are 2 categories of emergency contraception, levonorgestrel category and then Ella. So this is the list. Plans have to cover all of these categories of birth control without cost sharing. And it's important that you remember what this list is, because it's going to be determinative when you're talking to a patient or somebody who needs to get coverage. So this is all of the methods, but there's a very important caveat. All does not mean every. So it's true that plans can't exclude a method entirely. So a plan couldn't say, I'm not going to cover the ring. No, they have to cover the ring. That's a separate method category, as I showed you. Or the plans could not only cover generic birth control, because we know that some of those birth controls don't have a generic, so that would mean an all-out exclusion. So plans can't do that, but they do have a little bit of leeway, and their leeway comes in being able to exercise some medical management within the method categories. So they only have to cover 1 item per method category without cost sharing. And that plays out differently depending on the category, right? So if you have a category like hormonal IUDs, where there are a couple of options, they can choose to only cover 1. So they could choose to cover Liletta, but they're not going to cover the other IUDs without cost sharing. But for copper IUD, right, they're going to cover it. So it really depends on the method category and how many options there are, but they do only have to cover 1 item per method category without cost sharing. The other thing that plans can do is choose to cover generics instead of brand names. And obviously that's most relevant for the pill, right, given how many generics there are. But they can choose to do that. Now they couldn't do it, as I said, if there were only brand names and no generics available. They couldn't say, we're only going to cover generics. Can't do that. But if there's a bunch of options, they can pick and choose among them. Now that leeway that I just described might seem really problematic for your patient, right? Because what if your patient needs the brand name? That's the only one that works for them, or needs something that the plan has decided not to cover. Well, the good news is that there is a workaround that will guarantee that your patient gets the exact method she needs, and that is this waiver process. So plans have to, by law, they have to have a waiver process which allows a woman to access the specific birth control product that is right for her, even if the plan typically would say there's cost sharing attached, or even if the plan decides not to cover it. And what this involves is the provider doing some paperwork on why that method is medically appropriate. And what's amazing here is that the plan actually has to defer almost entirely to the attending provider's determination. And that can include things like the severity of side effects, the patient's ability to adhere to a particular item. So it's unlike what we've seen from plans in other areas, right, where they get to determine what is medically necessary. Here it really is the provider's determination of what method is medically appropriate for that patient. So just as an example, if you have a patient that has really bad side effects when using the generic version of a drug, but tolerates the brand name drug, and so you determine this brand name drug is medically necessary for this patient, but the plan either wants to put cost sharing on it or doesn't cover it at all, then you have to be able to use this waiver process to get that patient coverage of that brand name drug without cost sharing. It involves a few steps. You have to fill out paperwork, as I said, but that patient should be getting the method that she needs. So in essence, what this waiver process does is really kind of say all does mean every, right? Because it means that whatever particular item your patient needs, she should be able to get. She should be able to get the birth control that's right for her. In terms of what else the benefit requires, plans also have to cover associated services. So that includes the visits and the services to get birth control, and it also means that there might be some follow-up and management, side effects, counseling for continued adherence, device removal, all of those things have to be covered without cost sharing. And that's because it's not just getting that method itself, right? That's not the only thing that's part of the preventive services. There are costs that go along with the method that could keep certain methods out of reach, right? If a woman has to pay for an ultrasound, for example, or a pregnancy test, whatever goes along with getting that method, we need to make sure all of those things are covered so that a woman truly can have the option to get the best birth control method for her. So that's what this law says, that it's not just the item itself, it's everything associated with it. It has to be covered without cost sharing. So as examples, right, it's IUD insertion, it's the ultrasound to confirm placement, it's the removal if she needs to get it removed. For sterilization, it's the anesthesia, it's confirmation tests. All of those things that go along with getting your birth control method have to be covered without any cost sharing. So that, again, is really new and groundbreaking for individuals to be able to access all of that, and for you as providers to be able to make sure a woman is getting that without cost sharing. I do want to mention a couple other things that plans can do in terms of cost sharing, and that's they can impose cost sharing if a woman goes out of network for services. So there is still an in-network requirement. Now, if there isn't a provider in network and the woman is forced to go out of a network, then it does have to be covered without cost sharing. But assuming she has a network, she needs to go in network first. And then the other thing that plans can do is require a prescription for over-the-counter methods in order to get it without cost sharing. So some of the emergency contraception, for example, which is available over the counter, a woman would need to get a prescription first if she wanted to get it covered without cost sharing if it wasn't already. So that's the benefit in a nutshell. And I just want to take a moment before I go on to problems that we've heard to just remind everybody what a game changer this has really been for women, right? So we know that this benefit, when it went into effect in August 2012, it started changing things already. And we know that now over 55 million women are eligible for this really important benefit because it's a combination, as we said, of private insurance, the individual market insurance, and in the Medicaid expansion too. And we know that women are saving money because they don't have the costs, and I'm going to give you some numbers in a minute, but really this has made a big difference for a woman's bottom line in terms of her out-of-pocket spending, not having to pay for birth control. And we know that cost is no longer an obstacle in choosing your birth control method. And so that's allowing women to choose the more effective, longer-acting methods that traditionally have had these really high out-of-pocket costs that kept women from choosing them. We know that for some women, they're going to use birth control more consistently and more correctly, and it means that some women are finally going to be able to use birth control for the first time because they weren't because of cost or other issues. So all of this, we're hoping, is resulting in a reduction in unintended pregnancy, as I said, which has really positive health outcomes for the women and any resulting children she may have, and of course it has a positive effect on other goals of women in terms of finishing education and advancing in her career. And so it really has been a game changer for women, and we're expecting to see the benefits roll out in the years to come as we really start to see the public health effects of this benefit in place. Now here's a slide from our friends at the Guttmacher Institute showing you that the coverage guarantee is working, and you can see the difference in percentages from the blue is fall 2012, just before the Affordable Care Act took effect, and this benefit in particular took effect, and then you see the red is, or orange is spring 2014, and how many more women are paying zero out of pocket for a range of contraceptive methods. And so these percentages are just going to keep increasing and keep increasing until hopefully we get to 100% of women not having to pay out of pocket for any birth control method they're getting. We also know, in terms of the benefit working, a couple of data here, we know that women saved $1.4 billion just on the birth control pill in 2013, in 1 year. And so, as I said, this is saving women money, and it's meaning that they can put that money to other things like food or rent or anything else that they need for their household budget. So that's made a huge difference. We also know that in 2013 there was nearly a 5% uptick in filled prescriptions for birth control pills. So women are using that benefit. They're going to pick up their pills. And from Express Scripts, one of the large pharmacy providers, we know that the use of insurance coverage for birth control increased over 17% from 2014 to 2015. So again, women are using this benefit, and they're using their insurance coverage for it, and they're not paying out of pocket for the birth control they need. So that's a great result for everybody. Now, I wanted to talk a little bit about the resource that we provide at the National Women's Law Center for all of you and for your patients that you might interact with, and then talk a little bit about some of the problems we're still hearing from women in terms of trying to get access to their benefit. So we have a hotline called Cover Her, and you see the logo there, and our website is coverher.org. We also have a toll-free number that women can call that you can get to from that website, and basically what we do is we offer one-on-one assistance to individuals if they're not getting their benefit. And when you refer a patient to our Cover Her hotline, you're basically making sure that they're going to get all of the information that they need about this benefit. So they're going to get basics about the law's requirement, they're going to get help learning which plans are and are not allowed to do certain things and who has to cover it and who doesn't. You're going to figure out if this part of the law applies to their plan, and they're going to get instructions and sample appeal letters to make it easier for them if they're still being charged cost sharing and they shouldn't be. So you can see we have a bunch of online resources. We have Q&As, we have sample appeal letters, we have a script for calling your insurance plan to find out if your plan is grandfathered, to find out why you're not getting the benefit, if you should be getting it. So all of that is available on our website, and we're finding that more and more people are able to resolve problems themselves by using the resources we have on our website rather than needing to call us. Although we still do get calls, and we're happy to work one-on-one with individuals. But for the most part, people can figure it out and use our resources to resolve the problem themselves. I should also mention, just in terms of the instructions and the appeals letter that we have on our website, even though we're focused right now on the birth control benefit, the toolkit and the materials that we have on our website is really for women who have been inappropriately charged cost sharing for any of the preventive services that they should be getting. So whether it's being charged for a breast pump or the well woman visit, those are all part of the law's requirement, and they should be covered without cost sharing, just like birth control. And so the materials there help them no matter what they might be getting charged for. So we have this resource available, and we know that, with any new requirement, it takes some time for full compliance. So we wanted to make sure we had this resource available for individuals as the plans come into compliance, and so that we could help individuals. And what we have done is, heard from women, not only on our Cover Her hotline, but we've also looked at plan documents in a number of states to see if they are in compliance and if they are providing what they should be providing. And here are some of the common problems that we still know are happening. So the first is we know that some women still just aren't getting coverage without cost sharing. That might be because they're in a plan that's grandfathered. And so first what we have to do is help them call customer service and make sure that they ask the questions. We have a flow chart, as I said, on our Cover Her site, so that the person knows which questions to ask to find out if they're grandfathered, but that still is something that we hear, that some women are in grandfathered plans. It might also be that a woman is in a plan, she works for a church or a different house of worship, and they don't have to provide the benefit. There's an exemption for certain religious employers where they get out of it altogether. So that could be the reason a woman's not getting coverage. But sometimes a woman's not getting the coverage just because the plan isn't complying with the law. And then we have the resources available to help that woman appeal her denial of coverage, and to make sure that the plan understands this is the law and they need to be covering it, and to change their policy. We've had some really good results, both nationwide and state by state, working with plans to make sure that they come into compliance with the law and change their policies that aren't. So another problem that we hear is plans failing to cover the services that are associated with birth control. So we know that women sometimes are still paying for follow-up visits or necessary tests. And as I said before, all of the things that are related to the method have to be covered. And so this has been a particular problem around LARCs, IUDs and implants, where follow-up visits and tests have still been charged to women. So there was one woman from Iowa who got a $730 bill for ultrasounds when her IUD had to be replaced. She shouldn't have gotten that. That should have been covered without cost sharing. Another woman who contacted us was charged for both a pregnancy test and an ultrasound related to her IUD. And again, these are things that should be covered without cost sharing and that she shouldn't have been charged for. So we're still hearing that as a problem. Another problem that we're hearing is around the waiver process, or the process by which you get the particular method you need, right? And so we know that in some cases, a woman can't find any information. She's looking in the plan documents, she's looking on the website, she's talking to customer service representatives, and she's like, you're supposed to have this waiver process, and they either don't know about it or they don't know how to access it. And so that's been a problem that we've heard. We also hear problems with the waiver process. Sometimes a plan tries to send a woman into prior authorization, and that really is not an appropriate process for birth control. That's because in the prior authorization process, as I'm sure you all know, they generally defer to a plan determination of medical necessity rather than the physician or the provider's determination. And as I said, in the birth control benefit, they really need to defer to the provider's determination of medical necessity, and defines that broadly as to severity of side effects or differences in permanence and reversibility of birth control, and ability of the woman to adhere to the use of the birth control. So there are different determinations that you look at when you decide what's medically necessary in the birth control benefit world, and that's not prior authorization. So that's not an appropriate path. So that's a problem that we've heard a lot, and that's actually a problem that we've heard recently from callers in Delaware who are not being told about a waiver process, or they are put into prior authorization. So that might be something that comes up for all of you. The accommodation I have here in quotes, I wanted to flag that for folks. There are employees who work for nonprofit religiously affiliated organizations like a Catholic hospital or a Catholic school, or for-profit companies like Hobby Lobby, and all of those religiously affiliated organizations were given an accommodation by the Obama administration. And basically what that says is that the employer's plan doesn't have to cover birth control, but the woman still gets the coverage. She just gets it directly from the insurance company. So the insurance company has to have a system in place where that woman gets that coverage directly from them, not through her regular employer plan, but directly from them, and it should be seamless to her. So she should still be coming to the clinic, and hopefully she'll only have one card, but sometimes we know that they have two, one for birth control, one for everything else. But she presents it, and everything should be handled on the back end, and she should get the same coverage with no cost sharing as anyone else does. It's just that sometimes there are problems related to that, or that's flagged in some way, and she might have questions about that, or you might have questions about it. But in theory, it should work the exact same way with the insurance company handling it all behind the scenes. And then the final problem I wanted to flag for folks that we hear about is some women who are a little bit older, age is 50 and older, they might continue to need birth control. Some women of that age still have reproductive capacity, and of course the birth control benefit is required for all enrollees who have reproductive capacity. And so we've heard and seen of some plans which impose an age limit. They say you can have this benefit unless you're 50, and then we don't provide it anymore. And that's not allowed. Plans can't do that either. So that's something that could come up. So those are kind of the common problems we have heard, and I'm happy to talk more if you have specific questions, walk people through, how we would resolve these for an individual patient. But I do want to leave you all with resources. Again, this is our Cover Her hotline, where you can go to find information that you need about all of the law, everything I've mentioned here, and all of the resources that we have for individuals. And then I also wanted to make sure to provide a link to an IUD, an implant guide to reimbursement that we put together with some other coalition partners that will hopefully have information that will be helpful specifically around LARCs. So with that, I will pause, and we can turn it to question and answer.